Welcome to the Explainer. Today we're diving into a question that sounds, well, pretty straightforward. How deep should a dental implant be? But here's the thing. The answer isn't just in a dental textbook. Nope. It actually starts with a 19th century Italian economist, his garden, and a discovery that explains everything from why you wear 20% of your clothes 80% of the time to, you guessed it, your teeth.
Yep, you heard that right. So to really get our heads around this, let's leave the dentist's office for a minute and travel back in time to a garden in Italy.
So what on earth do pea pods have to do with your teeth? Well, it all kicks off, believe it or not, with this guy, an economist named Vilfredo Pareto. And he wasn't trying to solve some huge economic puzzle, he was just checking out his pea harvest. And what he found would literally change how we look at, well, almost everything.
He noticed something kind of weird. About 80% of his peas, they were all coming from just 20% of the pods. A small number of pods were doing most of the work, and he thought, that's interesting. But then he started looking around, and he saw this 80-20 pattern absolutely everywhere.
I mean, he found that 80% of the land in Italy was owned by 20% of the people. It just kept popping up. And this idea became what we now call the Pareto principle, or you've probably heard of it as the 80-20 rule. And here's the crazy part. It applies incredibly to how dental implants work.
Okay, so here it is, the big connection. It turns out that about 20% of an implant's length, right at the top, takes on almost all the chewing forces. Think about that. A tiny portion of the implant is doing almost all the heavy lifting. So the million-dollar question becomes, where exactly should you put that all-important part? And that right there is where the whole debate in dentistry really kicks off.
Okay, so let's break this down. When a dentist is deciding where to place an implant, they're generally choosing from one of three main approaches. And it all comes down to where the top of that implant sits in relation to the crest. That's just a fancy word for the very top edge of your jawbone.
So you've got three main options. Supracrestal, which means the implant top sits above the bone. Crestal, or sometimes called equicrestal, where it's placed right level with the bone. And then subcrestal, where, you guessed it, it's placed below the bone. Above, on, or below. Each choice has huge consequences, both biologically and mechanically, for how that implant is going to hold up over time.
All right, so which one is best? Let's look at the evidence. For a long time, the standard procedure was crestal placement, putting it right level with the bone. But there was a known issue. Dentists would often see a little bit of bone loss right around the top of the implant after surgery. It was almost like the body was trying to create its own little buffer zone.
So to fix that problem, the supracrestal approach came along. And the logic here is really simple and kind of brilliant. You know there's a tiny gap where the tooth connects to the implant, right? And bacteria love that little gap. So by placing the whole connection above the bone, you're moving that gap and all those pesky bacteria away from the bone. And yeah, studies showed this works pretty well for preserving bone long term. But then you have the subcrestal approach, going deeper. And this is where things get really interesting because this method has some serious advantages. For one, it just looks better, especially in the front of your mouth because it hides that little metal part of the implant under the gums. But even more importantly, from a physics standpoint, studies show it can actually result in less bone loss and handles chewing forces much, much better.
And this chart really tells the story. Look at the bar for crestal placement. The stress from chewing forces can go way up past what we call the physiological limit. That's the overload zone. And when you overload bone, it can actually shrink away. Now look at the subcrestal bar. Same chewing forces, but the stress is way down in the healthy zone. It's not just avoiding damage, it's distributing the load in a way that helps keep the bone strong.
Okay, so case closed, right? Deeper is better. Just put all implants subcrestally and call it a day. Well, not so fast. This is where the story takes a massive twist. It's not that simple.
So if deeper is better for the bone, should all implants be placed that way? The answer, surprisingly, is a hard no, and the reason why has almost nothing to do with how deep you go and absolutely everything to do with the connection between the implant and the crown.
Right, so let's talk about this piece called the abutment. Think of it as the connector. It's the part that screws into the implant in your jaw, and then the tooth, or the crown, attaches to it. And the real troublemaker is the tiny, microscopic gap where that abutment meets the implant. Here's the problem. If that connection isn't rock solid, every time you chew, there's a tiny bit of movement, what scientists call micromotion, and this creates a disgusting little pumping effect. As this quote from Zitrick explains, it literally pumps bacteria and junk from inside that connection down towards your bone, and that leads to inflammation and bone loss, the very thing you're trying to prevent.
So now we get to the real heart of it. You can only go deep, you can only place an implant subcrestally if the implant system you're using is specifically designed for it. It has to be built to completely get rid of that nasty pumping effect.
So what does that look like? Well, there are basically 3 keys to a successful deep placement. First, the connection itself has to be incredibly secure, something like a Morse taper connection that seals the gap and stops the pumping. Second, the design needs to have something called platform switching. This is a clever trick where the abutment is a bit narrower than the implant, which shifts that gap horizontally, away from the bone. And finally, the best practice is one abutment, one time. You put the final connector on during surgery and then leave it alone, so you're not constantly messing with the gums and bone.
And that brings us to the big takeaway. There is no single best depth. It's not a one-size-fits-all situation. The optimal placement is a really sophisticated decision. It's about a clinician balancing the biology, the mechanics, and the specific technology of the implant they're using. It's about matching the right tool and the right technique to the right patient.
I love this quote from one of the source articles. It puts it so perfectly. An implant system is like a boyfriend. If you do not know him very well, he may cause you lots of problems. It's a funny way of saying something dead serious. A dentist has to know their implant system inside and out. You can't just pick one up and assume it works like all the others.
And really, that's what this all boils down to. That critical 20% of the implant we started with, the part that does all the work, it's not just about how deep you place it, but about how incredibly well-designed and stable its connection is. So the next time you think about dental implants, maybe the question isn't just how deep is it, but how good is the connection? Because at the end of the day, that's what really matters.